Okay, so bottom line here, we need to figure out the basic procedures, and then really talk about some of the best practices of cricothyrotomy itself. So, from a basic standpoint, you got to figure out, okay, so if this guy's just awake, and he's awake and he's maintaining his airway, which the biggest problem is if he cannot maintain it anymore. It doesn't look like, from looking at his picture, that you can essentially bag him, right? Because his tongue is so far down, the tissue, like even his skin is kind of stretching. So if you're gonna transport this guy like in an ambulance sitting up, be ready for suction. You got to be real careful about thinking about sedation, about giving pain medicine, because any of that could take his ability. It could make him sleepy from different mechanisms there from those medicines. That would take his ability away to be able to protect his own airway. So, if you're going to do that, then you need to have the cricothyrotomy ready to go right behind it, or be ready to do a tomahawk, where you put the blade in and you just you're looking down from here. They're just sitting up, but he's going to fight you on that. So that's kind of the problem. So then that goes to advanced. So we're talking like blow by oxygen, non-rebreather cranked up to 15 or more, and just kind of in his direction to make sure we're oxygenating well. IV obviously established and in place, ready to give medicines. We have the medicines ready to go in case we do need to try to intubate him. Or put him out so that we can cric him. Medicine, it's an RSI, right? And even if, the whole point of RSI medicines is to relax let me do it this way so you can hear the microphone, is to relax all the muscles so you can reach in and just pull all this tissue forward so you can bring it to where you can see straight down the airway. So, get on your phone with your medical director. You might need to do that to put this guy out to be able to get the cric. But the cric it's just a tough call. Not the cric, but the, giving him sedation or pain medicine for it. So you got to be real careful, real judicious if you're going to do the basic route. If you're going to go the advanced route, obviously IV, fluid bolus ready to go. Give him fluids, blood products if he needs. The idea here is that if you're going to do this, then have the plan. Are you going to try to use the tomahawk? Are you going to try to use a regular? Because it doesn't look like there's much to move. And a lot of times with these patients, it's easy to see the airway. And you hear people say all the time, just hit the bubbles. Suction as best you can. You can usually make out the structures. Be ready for a cricothyroid. Have to do a cricothyrotomy. Which brings us to, if we're talking about medicines for this guy's blood pressure is okay. Maybe he can do some Versed and some pain medicine. Depending on your protocols, your guidelines. One of the things once you do this, like anything else, so you want to try to hyperoxygenate as best you can. We can't bag him, but we can put a whole lot of oxygen in there and let him breathe and let him just try to take deep breaths as best he can to improve his oxygenation as much as possible, so that when we do put him down, we have more time. Once you get if you get the tomahawk, you get it in, you get your medicine. So again, if his blood pressure is okay, then no problem. You can kind of use whatever. But if his blood pressure is low, then we got to worry about something more like etomidate. Some places use fentanyl, but use your own guidelines and protocols. Ketamine would be a good drug there. But as soon as he starts going incapacitated, we got to be suctioning and keeping oxygen going down as best as possible. And then, so you're going to want to get, a good bolus in, and then potentially get him paralyzed pretty quickly so you can manipulate the tissue. If not, then we cut him, which brings to the next part. We need to make sure that we're okay with performing cricothyrotomy. One of the best things, if you see here, there we go. Right here. Is the airway. Okay, so there's the biggest vessels that run right next to it. Right here is your carotid artery. Then you have the vagus nerve right next to it, and then you have the vein in between. So you want to be real careful to stay just on that most anterior portion. And when you feel for it, what you're doing is you're trying to feel for the largest kind of bump, the largest portion. It's right there for me. And so ideally what you want to do is to come in and cut. I mean, nothing crazy. You don't cut here to here, but you cut just a little bit above and below, a vertical incision. And what that does is it gives you an ability to feel. You're not going to be able to see. This is a tactile procedure, but what you want to do is you want to get into that structure, and then these are scissors. Right? You feel this round, kind of sharp point. That is the bottom portion of your thyroid membrane, and what you want to do from that point is go a little bit inferior, and you touch and you go into this little valley. That's your cricothyroid membrane. When you make an incision, should be a little bit more prepared, I guess. You do an incision. When you cut into, so you feel the peak and the valley, you slide down. There's your spongy area. You puncture through. You cut all the way over to the side, all the way over, and then you reach a physiologic endpoint. Turn the blade around, cut. You're making a sawing motion. Cut to the side, you'll hit another cartilaginous endpoint. The cricothyroid membrane is like just a little small circle opening. You physically can't cut with that 10 blade much when you get to the cartilage there. So now's the time not to be worried about like how big is the hole. Make a big incision horizontally. When you're cutting through that membrane, cut it. And another best practice is for sure the bougie. And if you have, in most surgical crite kits, you'll see a trousseau dilator, which just makes the hole bigger. You basically insert into the hole, and when you squeeze the scissor-like motion, forceps motion of this dilator, it doesn't bring things in, it pushes it out, so it dilates it open. Then you get a trach hook, and you basically hook, and you hook at the top part, and you pull up, and so you're basically pulling this up to where you can access the opening better. So once you have that up, now you can put your bougie in, and over that you drop your Shiley or your endotracheal tube, whichever you use at your program, and then there you go. And it just takes practice. There's all kind of ways to practice it. You can make your own. There's a lot of 3D printer stuff out there now. You can actually get pig trachs, whether they're sold commercially or you get it from a butcher. Practice it. Practice. One of my favorite things that I've heard recently is as people are doing it, people are pouring tomato sauce over the top of it because that's what it's going to look like. It's going to bleed. You have to practice the feeling of, okay, this is the most prominent that I feel right now. Okay, so we make a vertical incision, and when you cut, you dissect down. You keep hitting, going until you reach like something you can't cut anymore. It's going to bleed, but then you reach in and you feel, okay, there's that point, and slide right down, and at that point exactly where the cricothyroid membrane is. Puncture all the way to one side, turn the blade all the way to the other, drop your bougie, get your trousseau dilator in there, and then your trach hook, and then drop your plastic. Those are some best practices that are going on right now. So hopefully that helped. Always be ready to do this. And by the way, there's no right or wrong way with the basic or the advanced airway here. It's just when they go out and they can't protect their own airway, then we need to jump in and be ready to do what we can pharmacologically and from a skill wise in putting getting an advanced airway in or doing a surgical maneuver and cutting. And if you have like some of the new trach stuff or the devices that is just like a big introducer and catheter, then just practice with that as well. But be ready to do this anytime you go out, to go take care of people. All right, I hope this helped.